Most men over 60 believe that getting up 2, maybe 3 times a night to use the bathroom is simply part of getting older. You talk to your friends at the coffee shop and they complain about the same thing. You mention it to your spouse and they just sigh, used to the sound of your footsteps on the floorboards at 3 a.m. We treat it as an inconvenience, a nuisance that steals our sleep. But we almost never treat it as a warning. But what if I told you that your nightly trip to the bathroom isn't just about your bladder? What if that specific repeating rhythm in the middle of the night is actually the way your body is trying to signal that something much more significant is happening deeper inside, something that has nothing to do with the amount of water you drank before bed? There is a massive difference between a bladder that's just acting its age and a prostate that is sounding an alarm. Today, we are going to look at why that nightly habit is often the very first and most ignored clue in the early stages of prostate health decline. I'm going to show you the specific, subtle changes in how you go that differentiate a simple inconvenience from a medical priority. Most people wait until there is pain, or until they can't go at all to see a doctor. But by then, the early stage has already passed. If you are 60 or older, you need to know exactly what to look for, how to distinguish a normal shift in your routine from a genuine red flag, and more importantly, how to take control of your health before a routine symptom becomes a life-changing diagnosis. We aren't just talking about bathroom habits today. We are talking about reclaiming your peace of mind and potentially catching something before it becomes impossible to ignore. Stay with me, because the truth about why you're waking up is likely not what you've been told. My name is Dr. Marcus Thorne, and I have spent decades in clinical practice focusing on men's health and geriatric urology. I have sat across the desk from thousands of men who pride themselves on being tough, men who dismiss discomfort as a badge of honor, and men who believe that as long as they aren't in acute pain, everything is fine. But my job isn't to take your word for it when you say you're fine. My job is to look at the patterns your body is creating, often long before you even realize those patterns are there. We often view the prostate as a simple plumbing issue. We think, it's a gland, it gets bigger, it pushes on the tube, and now I have to go more often. And while that is a common reality of aging, it is a dangerously incomplete picture. By focusing only on the getting bigger part, what we call benign enlargement, we become blind to the more subtle, more dangerous changes that can occur in the same vicinity. When we talk about prostate health after 60, we are walking a very fine line between natural physiological shifts and the quiet, creeping onset of something much more invasive. The frustrating part of my practice is seeing patients who come in with a stage 2 or stage 3 concern, and when we go back through their history, we find that the symptoms were there for years. They were just masked by the idea that this is just how it is at my age. Quick favor before we go any further, drop your city, state, or country in the comments. When I see where people are watching from, it helps me understand the different environmental and lifestyle contexts you are dealing with, and it helps me tailor this advice to what you're actually facing. I read every one of those comments. Now stay with me, because the story I want to share with you next is something that I've heard repeated in my office more times than I care to admit. Let me tell you about a patient of mine. Let's call him Arthur. Arthur was 63 when he first came into my office, and he was the picture of the typical stiff upper lip generation. He'd spent 40 years in construction, raised 3 kids, and prided himself on never taking a sick day. When he finally sat down in my exam room, he wasn't there for his prostate. He was there because his wife had insisted on it after he'd spent 2 weeks complaining about a stubborn bladder. Arthur told me his routine with complete confidence. "Doc, I'm 63. I've earned the right to wake up at 2 a.m. to use the facilities. It's annoying, but it's just the cost of doing business at my age." He'd spent the last year managing it. He stopped drinking water after 6 p.m. He knew exactly where every public restroom was in his neighborhood. He'd structured his entire life around this rhythm. To him, it was a nuisance he had conquered. But as I began to ask the questions he hadn't thought to connect, the story changed. It wasn't just the frequency, it was the quality. Arthur mentioned that sometimes he'd feel like he had to go. He'd stand there for a minute and then nothing. Or he'd finish, go back to bed, and feel a lingering sensation, a quiet, nagging pressure that didn't quite disappear. He dismissed it as leftover fluid, but to his body, it was a signal that the flow wasn't being controlled properly. He told me about a night when he'd tripped slightly in the hallway because he was moving too fast, desperate to get back to sleep before he became fully awake. He fell, bruised his shoulder, and decided that was the moment to finally get it checked. When we ran the initial screenings, we didn't find the simple, benign enlargement he was expecting. We found changes in the density and texture of the tissue that were far more concerning. Arthur had been living with a slow, silent progression for months, interpreting every warning sign as a simple consequence of getting older. He had become an expert at managing the symptoms, but he had completely missed the disease. He told me later, "I thought I was just managing my age, Doc. I didn't realize I was managing a ticking clock." Arthur had to go through a rigorous treatment path, and it was a difficult road. But he often tells me, "If I had known the difference between a bladder habit and an organ alarm, I would have been in your office a year earlier." To understand why Arthur, and perhaps why you, might be misinterpreting these signals, we have to look at the anatomy. The prostate gland is roughly the size of a walnut, and it sits right at the base of the bladder, surrounding the urethra, which is the tube that carries urine out of your body. Think of it as a gatekeeper. When this gland remains healthy, the gate functions smoothly. But as we age, the prostate naturally tends to grow. This is what we call benign prostatic hyperplasia, or BPH. When the gland grows, it naturally squeezes that tube. This causes the classic symptoms: a weaker stream, a feeling that the bladder isn't fully empty, or the need to go more often. This is the common nuisance that most men expect. However, there is a dangerous trap here. Because these symptoms of BPH are so common, we tend to put every single change in our bathroom habits under that one umbrella. We see the need to go and we assume the gland is just getting bigger. But here is where the physiology turns critical. Prostate cancer, especially in its early, most treatable stages, often does not start in the center of the gland where it squeezes the urethra. It frequently begins in the outer zones of the prostate. Because it starts on the outside, it doesn't always pinch the tube early on. It grows silently. It might only begin to interfere with your habits when it starts to press against the bladder wall itself or causes localized inflammation that irritates the nerves in the region. This creates a phantom version of BPH symptoms. You feel the need to go, but the mechanism causing that feeling is fundamentally different. It isn't just a physical blockage, it is a structural change. When you wake up in the night, your body is responding to a bladder that is being stimulated or restricted by a process that is not just natural aging. Ignoring the difference between "I need to go because of size" and "I need to go because of something else" is exactly how a small, manageable health issue transforms into a diagnostic crisis. You aren't just dealing with a larger gland. You are dealing with an organ that is losing its structural integrity. I want you to stop for a second and really consider this. What if the nightly trip to the bathroom is actually the only early warning system you have? Most men wait for pain. They wait for blood. They wait for a total blockage. But by the time those symptoms show up, you have effectively bypassed the early stage entirely. The most dangerous lie in men's health is the idea that no pain means no problem. In the case of prostate health, the absence of pain is not a sign of health. It is a sign of silence. The prostate is a relatively quiet organ. It doesn't have a robust nerve network that sends sharp, localized pain signals to the brain in the early stages of a concern. It doesn't throb like a toothache or cramp like a muscle. It communicates through function, or more accurately, through the dysfunction of the systems around it. If your bladder is screaming for attention at 3 a.m., your prostate isn't causing the problem in a vacuum. It is physically changing the environment of your pelvis. Here is the belief-breaking reality. Your nightly habit isn't an inconvenience you have to live with. It is a physiological data point. And if you are only treating it by limiting water or buying better slippers for the walk to the bathroom, you are ignoring the data. You are treating the messenger and letting the message, whatever it may be, go completely unread. We have to stop viewing these nightly interruptions as a nuisance to be tolerated and start viewing them as a diagnostic signal that requires investigation. The urgency isn't about the inconvenience of the walk. It's about the reason for the wake-up. Now that we understand why the prostate is a silent communicator, we need to talk about the specific warning signs that separate a standard, benign aging process from a true medical concern. I am not talking about the simple fact that you need to go. I am talking about the way in which your body is asking you to go. If you are 60 or older, you should be hyper-aware of 3 specific red flag patterns that deviate from simple bladder fullness. First, look for the inconsistent flow sign. This isn't just about a slow start. It is about a stream that starts and stops, or a flow that seems to change direction without you doing anything. When the prostate gland experiences irregular tissue growth, it can create an uneven surface. Think of it like a pebble in a garden hose. It causes turbulence. If your stream feels erratic or unpredictable, that is not just age. That is a structural issue. Second, pay attention to the urgency without volume syndrome. This is when your body wakes you up with a sense of extreme urgency. You feel like you absolutely must go right now. But when you actually reach the bathroom, the volume of urine is surprisingly small. This happens because the prostate, or a growth within it, is pressing directly against the sensitive nerves of the bladder neck, tricking your brain into thinking the tank is full when it is actually nearly empty. This is a classic indicator of local irritation that needs to be checked by a urologist. Third, we have the lingering sensation trap. After you have finished and returned to bed, if you still feel a heavy, dull, or nagging sensation in your lower pelvic region, that is a warning. A healthy bladder emptying cycle should provide immediate relief. If that feeling of pressure remains, it suggests that the prostate is interfering with the bladder's ability to contract fully, or that there is a level of inflammation present that simply shouldn't be there. These are the subtle, granular details that most men ignore because they aren't dramatic. But to a trained professional, they are loud, clear indicators that it is time to stop guessing and start screening. It is easy to hear this and think, well, I'm sure it's nothing. But the clinical research tells us exactly why that mindset is so risky. A significant study published in the Journal of Urology examined the link between nocturia, the clinical term for waking up to urinate, and the presence of underlying prostate pathologies. The researchers tracked a cohort of men over 60, specifically looking at those who reported nighttime urgency as their primary complaint. The findings were striking. The study demonstrated that men who experienced high-urgency nocturia had a significantly higher statistical likelihood of presenting with prostate-related concerns, including early-stage malignancies compared to those who only experienced slow flow or simple frequency. The researchers concluded that the bladder is an incredibly sensitive proxy organ for the prostate. When the prostate begins to undergo cellular changes, the nearby bladder nerves are among the first to be sensitized by the resulting inflammation or pressure. Furthermore, a large-scale analysis in the British Medical Journal highlighted that for many men, these seemingly minor urinary symptoms were the only clinical markers present for years. The study emphasized that delay in seeking evaluation for lower urinary tract symptoms is the most common reason for late-stage diagnosis. In plain language, the science confirms what I see in my office every day. Your body is not waiting for a major collapse to tell you something is wrong. It is whispering to you in the middle of the night. The research proves that those who act when the symptom is just an annoyance, rather than a crisis, have a success rate for treatment that is exponentially higher. The data isn't here to scare you. It is here to provide you with a window of opportunity that you simply cannot afford to leave open indefinitely. So what should you actually do? The first step is to shift your mindset from management to investigation. If you have been waking up at night, I want you to start a bladder diary for exactly 3 days. Don't just note that you went, note the time, the approximate volume, and whether you felt that lingering pressure I mentioned earlier. This data is the most valuable tool you can bring to a doctor. It stops the guessing game and gives your physician a clear, objective picture of your symptoms. Second, be specific during your next physical. Do not just say, I'm having some trouble with my bladder. That is too vague. Say, I am waking up multiple times a night, and I am noticing an urgency that doesn't match the volume. That specific phrasing tells your doctor that you aren't just complaining about age, you are reporting a functional pattern. Third, ask about a PSA baseline if you haven't had one recently. A prostate-specific antigen test is a simple blood draw that helps screen for issues long before they manifest as physical blockages. If you have a family history or if these nighttime habits have been worsening over the last 6 months, don't wait for your annual checkup. Schedule a consult now. Remember, the goal here isn't to be an alarmist. The goal is to be proactive. Modern medicine has incredible ways to manage prostate issues, but these treatments are most effective when they are applied to early, manageable tissue changes. By taking these 3 steps, tracking your symptoms, using precise language with your doctor, and getting your screening baseline, you are taking the control out of the disease's hands and putting it firmly back into your own. You have earned the right to a full night of uninterrupted sleep, but more importantly, you have earned the right to the peace of mind that comes from knowing you are taking care of yourself. Don't settle for "it's just old age." You deserve better than that. It's time to move past the idea that your health is something you just endure. Those nightly trips to the bathroom aren't a sentence you've been handed. They are a signal you've been given. And by choosing to listen to that signal today, you've already taken the most difficult step toward protecting your future. I want to thank you for staying with me until the very end. Your willingness to look at the uncomfortable, to ask the hard questions, and to prioritize your long-term independence is exactly what separates men who just drift through their later years from men who take active charge of their vitality. If you found this breakdown helpful, please subscribe to the channel. We are building a community here for men over 60 who refuse to accept "it's just old age" as an answer. And I'd love to have you with us for our future discussions on protecting your health. Tap that next video on your screen. It's a deep dive into the inflammatory foods that most men ignore, which can be making these prostate symptoms even worse. And before you go, drop a comment below and rate this video from 1 to 10. Your feedback tells me exactly what topics you need me to cover next. Take care of yourself, stay vigilant, and I will see you in the next one.